Looking for warning signs of cervical cancer. One of the most common cancers in women worldwide, cervical cancer is extremely dangerous. It happens in the cervix cells, which is the lower part of the uterus connecting with the vagina. Most cervical cancer cases occur because of HPV, human papillomavirus, and women of any age can get this disease. The most unfortunate thing about cancer is that it doesn't show any symptoms until it spreads to other organs in the body like the liver, bladder, and lungs. Women do not observe any symptoms and signs at all in the early stages of cancer. It may take years for normal cells to turn into cancerous cells in the cervix. Risk factors of cervical cancer may include unprotected intercourse, multiple sex partners, overweight, history of sexually transmitted diseases, oral contraceptives, smoking, poor immunity, genetics, HIV, multiple pregnancies, organ transplant. Women should get the HPV vaccine, which can protect them from various viruses, including some of those which can cause cancer. But keep in mind that even if you're vaccinated, you still need regular checkups because the vaccine cannot protect you against all cancer-causing strains. Women can fight HPV infection, but if they are regular smokers or had many children, getting cancer increases. Even though women do not get any prominent signs, if you observe any unusual changes affecting your reproductive organs, immediately get yourself checked by a doctor. The good news is that the chances of getting treated with cervical cancer are highest if it is diagnosed at an early stage. Regular screening and follow-up with your doctor can save your life. Warning signs of cervical cancer. Let's see the top 10 warning signs of cervical cancer that you should never ignore. 1. Abnormal vaginal bleeding. The most common warning signs of cervical cancer is untimely vaginal bleeding. When cancer from the cervix spreads to other tissues and organs, it creates abnormal capillaries, which can be quickly and lead to abnormal bleeding. However, the bleeding can have other causes, such as a hormonal imbalance or some infection in pelvic organs. If you observe any unusual bleeding after intercourse, between menstrual periods or menopause, then consult a doctor immediately. Many women may think that it can be normal spotting, but do not take such a chance with your health. 2. Foul-smelling vaginal discharge. The cervical cancerous cells sometimes die due to lack of oxygen, and it affects the tumor. This creates a vaginal discharge that smells foul. Women with cervical cancer get a vaginal discharge that may appear pale, yellow, brown, or mixed with blood. 3. Pain during sexual intercourse. Pain during sexual intercourse may indicate the cervical cancer is in its advanced stages. Cancer may spread to other tissues and reproductive organs. Women who have cervical cancer usually experience severe pain while having sex and thick, foul-smelling vaginal discharge. If you have been getting this pain always, then do not ignore it. Get help from a doctor as soon as possible. 4. Pelvic and lower back pain. Continuous pelvic or lower back pain is a sign of cervical cancer. Women with cervical cancer get pelvic pain near the appendix only when they are in an advanced stage. Constant lower back pain is a severe sign of cervical cancer. Cramping and body ache during menstrual periods are normal, but if the pain lasts longer and beyond the periods, then it is a reason for concern. The pain in the pelvic area can start at any time in a month when the reason is cervical cancer. 5. Fatigue. Even though several other reasons in women can cause fatigue, if you experience exhaustion accompanied by other symptoms, we have discussed that. An anemic response can be a warning sign of cervical cancer and shouldn't be ignored. 6. Pain while urinating. One of the most apparent reasons for discomfort and pain while urinating can be cervical cancer. Women experience a burning sensation while urinating. These symptoms include pain, as well generally appear when cancer has developed into advanced stages. There can be other reasons for such discomfort like urinary tract infection, STDs, etc. It is always better to get checked to avoid any further damage. 7. Pain in legs. When cancer grows in a woman's body and gets more advanced, it starts pressing against the pelvic wall's nerves. This can lead to swelling and pain in the legs. Although other reasons can cause this kind of pain, contact a doctor if you notice sudden pain with other symptoms. 8. Unexplained weight loss and loss of appetite. An unexplained and sudden weight loss is a common symptom in many kinds of cancers. When cancer grows in the body, the immune system tries to fight it off by producing cytokines. Cytokines are proteins that are responsible for breaking down fat in the body. This causes weight loss even if you are eating normally. If you keep losing weight and lose appetite regardless of how much you eat, it can be a problem. If you have lost weight suddenly and it is happening continuously along with other symptoms, consult a doctor. 9. Longer and heaving menstrual periods. Regular menstrual periods can last from 4 to 7 days in women. However, if you experience heavier flow and longer menstrual periods, it can signify cervical cancer. If you are getting heavy bleeding and have to change your sanitary pads every couple of hours, get yourself examined immediately. Apart from cancer, unusual menstrual periods can be caused by hormonal imbalance, pelvic inflammatory diseases, or kidney diseases. Still, any changes in your regular period should be discussed with a doctor. 10. Change in bowel movements. If you feel like relieving yourself quite often and feel like you always need to pee, then it can be warning signs of cervical cancer. If this symptom prolongs more than a week, then get an examination done by the doctor. Always remember, prevention is better than cure. If you have been facing these warning signs, then do not wait to see a doctor.